Hello everybody, I hope all of you are good. Today we'll talk about an important common subject which is the pain of the elbow. This is our elbow, this is the elbow. We have three main categories in its pain source. We have something called tennis elbow, golfer's elbow, and the elbow joint itself, pathology pain. Today we will talk about tennis elbow. Tennis elbow is very common syndrome, affects 60 to 80% of the population, bother some people. Sometimes it comes severe and it takes long term. It takes sometimes 3 to 6 months to be resolved. And the pain will be at the lateral aspect of the elbow, which is the outer side. The scientific name, we call it lateral epicondylitis, which is the inflammation of the extensor tendon of the wrist, which attached in the lateral condyle of the humerus. So the pain of the elbow comes from the outer side of the elbow, which we call it tennis elbow. The main reason is not known actually in the tennis elbow. Repetitive action, overuse of the joint was accused that this is the main reason, which comes from the tennis players, from ping pong players, mechanics who use the screwdriver a lot, maintenance people who do some efforts in the extensor tendon of the elbow is accused. But sometimes you see normal people working nothing, desk work, clerks, comes complaining from this syndrome. On physical examination, this is the elbow joint, and this is the medial condyle, and this is the lateral condyle, which is the common origin of extensors with its tennis elbow. And this is the ulna, this is the radius, and this is the humerus. This is the lateral condyle, this is the medial condyle. So inflammation of this area, inflammation of the extensor common tendon of the wrist is the pathology of the cause of the tennis elbow. Actually, there is a lot of research done for the tennis elbow, but no specific pathology was taken out. The pathology of the biopsy taken from the extensor tendon showed small micro tears happened with inflammation of the tendon in the lateral aspect of the elbow, which is the extensor tendon. This doesn't give any big information. So the patient comes and say, I cannot move my hand, I cannot move my wrist. It's difficult for me to practice my daily habits, my daily movements. On physical examination, we see severe tenderness over the lateral aspect of the elbow. The treatment, we have degrees of the treatment. We start with simple painkillers, local gel, we put local gel. We can use some stabilizers, some splints, like silicone pads over the lateral aspect of the elbow. If we don't, we have no good benefit, we go to the injection, local injection of steroid, giving us good results sometimes, more than 60% of the cases. We may repeat it again, although it has some side effects, skin color problem, wasting of the muscles. There is a new trend of treatment now which is platelet-rich plasma injection, local. Then last but not least, the surgery. Surgery, we open and debride and dissect the tendon, and it may give relief. And that will be after 6 months of conservative treatment, which is tablet, non-steroidal injection, PRP, and these things. We need at least 6 months of period of non-healing or non-relieving of the tennis elbow to go for the surgical option. This is the most important thing about tennis elbow. We will speak in another episode about golfer's elbow, which is the inflammation of the flexor tendon, joint tendon in the elbow, which is in the medial condyle of the humerus. Until then, stay safe, wear your mask, take your vaccine, keep social distances, and be safe.